Which top 10 medicine is best for treatment of fever? When it comes to treating common fever, it is important to note that fever itself is not a disease but rather a symptom of an underlying condition. While over-the-counter, OTC, fever medicine can help treatment of fever symptoms, it is advisable to consult a healthcare professional for a proper diagnosis and treatment of fever plan. Additionally, the choice of medication may depend on factors such as the individual's age, medical history, and any existing conditions or allergies. It is always recommended to follow the guidance of a healthcare professional. That being said, I will provide an overview of some commonly used OTC medications drugs for the treatment of fever symptoms and fever management, but please note that this information should not replace 1. Acetaminophen. Paracetamol. Acetaminophen is a widely used medication for fever reduction and pain relief. It is available in various forms such as tablets, capsules, and liquid suspensions. The maximum daily limit to prevent potential liver damage from acetaminophen side effects.
Two, Ibuprofen. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that can help reduce fever, symptoms, relieve pain, and alleviate inflammation. Like any fever medicine, ibuprofen, it is important to follow the recommended dosage and consult a healthcare professional, especially for individuals with specific medical conditions, such as kidney problems or a history of gastrointestinal ulcers.
3. Aspirin. Acetylsalicylic acid. Aspirin is another NSAID that can help reduce fever and relieve mild to moderate pain. It is available in tablet and chewable forms. Aspirin is generally not recommended for use in children or teenagers due to the risk of developing Reye syndrome, a rare but serious condition. As with any NSAID, it is important to follow the recommended dosage and consult a healthcare professional, particularly for individuals with bleeding disorders or a history of stomach ulcers. 4. Naproxen sodium. Naproxen sodium is an NSAID that can help reduce cold fever, relieve pain, and reduce inflammation. It is a fever medicine available in tablet and liquid forms. Like other NSAIDs, it is important to follow the recommended dosage and consult a healthcare professional, especially for individuals with specific medical conditions, such as cardiovascular disease or kidney problems. 5. Combination products. Some OTC medications combine acetaminophen with other ingredients, such as decongestants or antihistamines, to address multiple symptoms associated with fever, such as congestion or cough. Combination products can be useful for managing fever along with other accompanying symptoms. It is essential to read the labels carefully, follow the recommended dosage, and be cautious of potential interactions with other fever medicine or existing medical conditions. 6. Herbal remedies. Some herbal remedies, such as chamomile, ginger, or elderberry, are believed to have fever-reducing properties. These remedies are available in various forms, including teas, extracts, or capsules. However, it is important to note that herbal remedies may not have the same level of scientific evidence or regulation as conventional medications. Consulting a healthcare professional is advisable before using herbal remedies, especially if taking other medications or having underlying health conditions. 7. Cooling measures. Alongside medication, physical cooling measures can help alleviate fever symptoms, such as using a cool compress, taking a lukewarm bath, or wearing lightweight clothing. Adequate hydration is also crucial to help manage fever and prevent dehydration. Circumstances and specific medical considerations. It is important to consult with a healthcare professional before taking any medication, especially if you have underlying health conditions, are taking other medications, or if the fever persists or worsens. 8. Homeopathic remedies. Some individuals may consider homeopathic remedies for fever management. Examples include belladonna, ferrum phosphoricum, or aconitum napellus. Homeopathic remedies are based on the principle of like cures like, and are highly diluted substances. However, it is important to note that the scientific evidence supporting the efficacy of homeopathic remedies for fever management is limited. Consultation with a healthcare professional is advisable before using homeopathic remedies, particularly if you have specific medical conditions or if the fever persists. 9. Rest, body and hydration. While medications can help manage cold fever symptoms, It is equally important to get plenty of rest and maintain adequate hydration. Resting allows the body to allocate energy towards fighting off the underlying infection or condition causing the fever. Hydration helps prevent dehydration, which can worsen fever symptoms. Drinking water, electrolyte solutions, or clear fluids can help maintain hydration levels. 10. Monitoring and seeking medical attention. It is crucial to monitor fever symptoms, especially if they persist or worsen, or if additional symptoms develop. Seek medical attention if the fever is accompanied by severe headache, stiff neck, breathing difficulties, chest pain, confusion, seizures, or if it persists for more than a few days. These signs may indicate a more serious underlying condition that requires medical evaluation and treatment.